Welcome back to Healthy Living. 1 in 3 South African adults live with high blood pressure, and it is responsible for 1 in every 2 strokes and 2 in every 5 heart attacks. South Africa has seen an exponential growth in hypertension or high blood pressure over the last 20 years. We spoke more to Dr. Tabetse to hear more about this condition. We're still with Dr. Tabetse at the Charlotte Macbeth Hospital in the cardiovascular unit. We're finding out more about hypertension and what does it mean to the South African population. Doctor, thank you for still staying with us. But coming back to what we spoke about earlier, we now understand the risks of hypertension, and we now understand that what we need to do when it comes to hypertension. But in South Africa, we're dealing with different populations, and we have, the white population, colored Indian, and of course the black African population. Do they present differently with different hypertensive and heart conditions?
Typically they don't. Hypertension doesn't discriminate. It affects anyone and everyone. However, in so saying, there is a trend where we've noticed that in the black population, it tends to occur at a much younger age and it tends to be more significant and elevated.
Now, when we look at this from a perspective of the different population groups, are you finding that the adherence to the treatment protocol is there, or do people just take it for granted? Because why? I'm just stressed. That's why my blood pressure is a little bit high.
Yes, so adherence is a huge factor because once you've been diagnosed as being hypertensive, the recommendation is that you then now take your medication lifelong. So we don't cure hypertension, but we control it. And the medication helps to maintain the blood pressure. And a patient needs to be motivated and compliant to take the medication in order to harness the benefit of being a normotensive or having a normal blood pressure. However, over time, we notice that a lot of patients do tend to default on their medication. Sometimes what we've observed is that a lack of insight in terms of counseling the patients and understanding what is this condition, what does it really mean for me? And as we mentioned, it's a silent disease. So if you're not complaining of anything, it's very hard to stay motivated to continue taking your medication.
When you look at it from a perspective of, I find people have a lot of excuses. So they'll either say, no, high blood pressure is in my family, so it's a genetic issue, I can't change it. Whereas other people say, yeah, it's my lifestyle, I'm eating unhealthy food, I'm drinking too much puza, I'm not exercising enough. And others will say, it's my environment, I just don't have the time, this is how I live. What would you say across those 3 factors would be something that is relevant to educate consumers about?
So basically, definitely, there is a genetic link. So if you have a parent who has hypertension or a family member or if both parents, you are twice as likely later in life to complicate and have hypertension. However, that's the genetic risk. There's obviously an interplay that you have also with your environment and your lifestyle. So if, for example, you work in a very stressful environment, you hardly exercise, you eat unhealthily, you consume a high salt diet, all of these basically confound and they work together to increase your cardiovascular risk, which is the primary problem with hypertension. So one ought to then take responsibility to say, yes, in my family, my parents may have been hypertensive. That means I now need to be more vigilant about what I do, what I eat, how often I exercise. And I think really education and an awareness and understanding of the disease goes a long way in empowering someone to change their behavior.
When you look at it from a perspective of obesity, we know that South Africa is gripped by this obesity crisis. I think we have the bronze medal globally for being one of the most obese nations. Does obesity impact one's blood pressure?
Yes, so obesity is one of the key risk factors for hypertension. In fact, hypertension, obesity, and insulin resistance later on, which may develop to diabetes, is what we call metabolic syndrome or metabolic phenotype. And that's what we have a pandemic of. So all of these 3 work together, they're almost like vicious twins or triplets that increase your cardiovascular risk to complicate with either stroke, heart failure, or peripheral vascular disease.
A lot of people in the country also take over-the-counter medication or things they find on shelves. And I'm talking about, supplementation, for an analogy. When you have osteoarthritis, then they sell you these glucosamine sulfate chondroitin products, and they advertise them everywhere. And a lot of people end up purchasing them. When it comes to hypertension, they do the same thing. They market these herbal medications and other things. What are your thoughts on this?
So over-the-counter medication are important culprits for secondary hypertension in the adult. So remember I mentioned in young adults or pediatric population, hypertension, there's usually these rare tumors that cause hypertension. But for adults who ideally should not be having hypertension, who abused medications such as non-steroidals. These are typical medications like pain tablets. Even some of your oral contraceptives can increase and predispose you to hypertension. Those are significant in terms of secondary causes. However, when it comes to medication, I would recommend that one sticks to the prescribed, known, evidence-proven medication. There's a lot of medications or self-medication that is being promoted in the community. Some will say they must take paprika, herbal concoctions and things like that. But really, that's just to help you maybe with your health, but we would recommend stick to evidence-based registered medication with known efficacy and side effect profiles.
When we're looking at measuring one's blood pressure, you can also get machines at pharmacies and everywhere else, and you have a plethora of options, and you end not knowing which ones to choose. I remember when I was studying the old school mechanism, put the cuff on the arm, get the phenometer, put it on the arm, and you're listening, and a lot of old school doctors still do that. Are there any particular machines we should be wary of, or does it just give you a nice benchmark?
Yeah, so it depends. So for the medical practitioners, they have to get certified and validated machines. The trend now is to actually get automated oscillometric machines, whereby a patient's blood pressure is taken when they are alone in a room, unattended, and the machine would do this at least 3 times, and we take a measure of the 3, an average of the 3, which would then use as the blood pressure. Only in patients where if the device is unable to measure, one would then have to use a manual sphygmomanometer to measure. That's in the clinical setting to diagnose hypertension. However, for the patients in their home environment or in the community, for them to monitor their blood pressure, again, a validated machine is usually good, although these tend to be pricey, so there's a different range of these machines. But we would still recommend, even if you get a machine that can give you a measurement, the measurement itself may not be as accurate, but what we're more concerned about in the community is the trend. Is your trend increasing? Is it stable? Is it decreasing? And that informs the clinician whether to up-titrate your medication at clinic or to leave the medication alone, to say that's well controlled. So I would advise patients, if you can go for a higher end machine, yes, but if whatever you can afford, it's still beneficial than not having anything.
Doctor, what is your final pearl of wisdom and take-home message for our viewers when it comes to hypertension?
I'd say please, all adults, at least once a year, have your blood pressure measured. Screening is so important because it's a silent disease. You'll never know what your numbers are unless you check. So please go and check and know your numbers.
Doctor, thank you for your time. Out of your hectic day here at the hospital, we appreciate it. And keep doing the great work that you are, looking after the hearts of our nation.
Thank you. Thank you for having me.
Now that we know all the critical information about hypertension and what medication to take, what you eat is critically important. We spent time in studio with Tony O'Brien, our resident dietitian, to find out more about what foods we should eat, what foods we should avoid when it comes to managing high blood pressure. Tony, thank you so much for joining us in studio.
Thank you so much for having me here on.
Knowing that there are millions of people globally and millions more in South Africa that are living with hypertension, and those that know it and those that don't know it, why is eating so important when it comes to managing this condition?
Okay, so Ron, when it comes to hypertension, diet plays a significant role because a lot of our blood pressure is affected by the foods that we eat, so salts and then other minerals like potassium and calcium, they all affect your blood pressure in your body. So that's why diet is so important. And then the other big factor with blood pressure is obviously your weight. So if you're eating too much and not exercising, your weight is going to increase and then your blood pressure can be worse.
When we look at it from a perspective of these minerals that you spoke about, everyone associates high salt with high blood pressure. Why is that?
Because salt can cause high blood pressure. If you're having too much salt, it affects your kidneys, water goes out into your cells, and it actually increases your blood pressure. So that is why having so much salt can increase your blood pressure.
Now, salt is this very unassuming thing because your taste buds can get used to a certain amount today and you'll need more tomorrow. And in a lot of foods that we eat, there are hidden salts everywhere. So from a food perspective, what should we be aware of? What should we steer away from if we do have hypertension?
Okay, so what you need to remember is that The part of the salt that affects your blood pressure is the sodium, okay? And sodium is found naturally in a lot of foods. So a lot of your fruits and vegetables, your grains, meats, everything has small amounts of sodium. Then if you have processed foods, they usually use some form of sodium to stabilize the food, preserve it, give it color, flavor, whatever. So it doesn't always show up as salt, and it doesn't have to be a salty food. Okay, and then the other thing to remember is if you are adding salt, the amount of sodium you're supposed to have in a day is equivalent to 1 teaspoon of salt.
Wow.
Which is not a lot. Yes.
Because I want to bring it back into this hidden salt.
Yes.
Food that we're eating all the time. And I'm thinking about the preserved foods, the canned foods. You know, it's actually becoming quite scary, because it's also affecting younger children.
Yes.
So when I look at salt, you said not more than a teaspoon.
Yes.
But when you look at the food labels, it's talking about grams and milligrams and micrograms, and you end up wondering, how do I then equate a teaspoon to what I'm reading here, because I don't understand it.
Okay, so when you're looking at your food label, on your food label you always have per serving of product and per 100 grams of product. And to know whether it's a good product, whether the sodium is below the threshold, it should have less than 600 milligrams of sodium per 100 gram of product. That's where you see, if it has more than 600 grams, it's not a product you should be having at all. And then obviously you need to see how much is a serving size, because now if you're having a huge serving, your sodium levels can even go up higher. So if you're looking at sodium as equivalent to a teaspoon of salt, we're looking at about 2,300 milligrams of sodium per day.
I think that's a wonderful thing to have in our brains. It needs to be etched into our brains. Yes. Because, you know, in speaking to the doctors that have advised us, you know, for today's show, is that they say don't look at it only from a perspective of the numbers that you know. You often don't know that you have hypertension, so you need to get it tested and measured. But in order to be preventative, watch what you're eating. And now that we know how much salt equals to the measurement that we're reading on the labels, it makes our life a lot easier.
It does, yeah.
When it comes to not only the preparation of the food and eating of the food, we also look at it from a perspective of finding a balanced plate.
Yes.
What role do greens and veggies and those things play when it comes to assisting us to lower our blood pressure?
Okay, so all your greens are very good, and generally all your vegetables have high potassium levels. And your potassium and your sodium basically counteract each other. So we need to be getting quite a bit of potassium to help lower your blood pressure, especially if you are getting too much sodium in your diet.
Stress also increases one's blood pressure, and we know that when people are stressed, what do? We eat. And we eat anything that's salty or sweet. So we risk increasing our blood glucose, but we also risk increasing the level of sodium and salt in our body.
Yes.
What would your advice be when it comes to emotive eaters and stressful eaters? Because that's going to compound a couple of factors, including our weight, that's going to impact our hypertensive states.
Okay, so for people like that, we really need to do more of a behavioral modification. So find other ways to deal with stress, some things like meditation, or even talking about the things that are stressing you out can really, really help. The other thing is to practice what we call mindful eating. So be aware of what you're eating, why you're eating, how much you're eating, rather than just shoving food in your face to try and fill a hole that the food is just not going to fill. So being aware of what you're eating can really help with the stress eating, and then also help to keep down the sodium intake and the bad food intake, and also in the long term help to control your weight.
Tony, thank you so much for your time, for joining us in studio and sharing these pearls of wisdom, because what I enjoyed about our conversation was that it wasn't just the theory on hypertension and healthy eating. It was the application of that theory in different scenarios, from preparation of food, to eating of the food, to shopping for the food, to managing your stress as well, because that impacts our waistline and ultimately our blood pressure.
Yes. Well, thank you so much for having me, Ron, and I really hope it's been helpful.
Now, that's how easy it is to live a healthy lifestyle. And what Tony has shown us, that we can implement into our lives is healthy eating, not just to manage our blood pressure, but also to be healthy for the long term. Exercise is important when it comes to managing and lowering one's blood pressure. Please do join us in this week's workout routine. Today's workout is all about the lower body. The leg muscle groups allow you to burn a lot of body fat, but also keep them shapely and toned. Ladies, are you ready? All right, let's get going. First things first, we're going to warm up by just running on the spot. Let's go. All right, good. Now that you do for at least 60 seconds, the warm-up allows your body to be prepared for the exercise ahead, minimizing injury and also maximizing the effect of the strength exercises. So the first one, we're going back to basics. We're doing the traditional squat. So feet wider than shoulder width apart, angle your toes out slightly, hands on your hips, and all I want you to do is imagine you're sitting onto a chair. Hold it for a second and come up. Go down, hold, and come up. And this you do for 60 seconds. All right, good. The legs should be feeling warm. But maximizing the leg workout, we obviously have those saddlebags we need to focus on. Yes, gents, it also affects us, and it's to do with hip strength. So ladies, right foot on the floor, left foot is slightly bent, and all I want you to do is raise up slightly and down. Raise up slightly and down. Let's go. 1, 2. Now this exercise allows you to focus on that hip area, and you do this for 30 seconds on each side. Change legs. 3, 2, 1. All right, now the last muscle of the legs we need to work is, of course, the calf muscle. Now the calf muscle has a wonderful endurance ability, which means you need to do quite a few reps to get that burn and that effect for that muscle. So angle the toes out, and all I want you to do is raise up on your heels and drop it down. And as you touch, you raise up. Let's go. 1, 2, and this you're doing for 60 seconds. Good, relax it down. Now, with the calf muscle, you can also change your foot position to give you a different effect on the different areas of the muscle. Remember, the meaty part of your calf is called your gastrocnemius, and that part has got the inside, middle, and outside. To work the outside calf, all you do is you angle your toes inwards. It's as simple as that. Let's end off with a nice stretch. And ladies, feet apart. And all I want you now to do is bend your right leg down, feel a nice stretch. Change size. Now with a stretch, you must go as low down as what you feel comfortable doing, okay? A stretch is meant to relax you, allow the body to recover after a workout. One more time on the other side. Good, up we come. Now that's how easy a weekend leg workout can be. You repeat this entire sequence for 3 or 4 more times to give you a tougher workout if you do feel that you're an advanced exerciser, but this you can do at home, outdoors, while on holiday, or even in the gym. That's all we have for you on today's show. Thanks for watching Healthy Living on Afro World View. From me, Ronald Avergy, and the team, keep warm and healthy. Cheers.